different infections, rule out osteomyelitis versus cellulitis. It's great for patients who have a prosthetic that's loosening, might be painful, and for diabetic ulcers. So in this case, Rusty has a loosening prosthetic in his knee.
Ow.
So Rusty, what I'm going to have you do first is make sure you don't have anything metal in your pockets, because that metal can actually block the energy of that radio tracer. So go ahead and make yourself comfortable. I want you to lay your head on the pillows, feet down here on the ends. I have a pillow here to give you a bit more support. And I'm going to tie a little rubber band around your toes to help you keep your legs still, because we don't want you moving during this picture, okay? So I'm going to position Rusty nice and center with the area of interest, which is his knee, in the field of view. I want to bring the cameras in nice and close to get that good image resolution. How are you doing, Rusty?
Very good.
All right, so this first part is going to take about 2 minutes, okay?
Okay.
All right, so just be nice and still. And then afterwards, the camera's going to immediately go into the other phase where the nuclear medicine is in your tissue. So first we do the venous phase where we watch it flowing through your veins, and then we're going to do the tissue phase, and it automatically goes right into it, so don't move. Okay?
Okay.
All right. All right, Rusty. You're done with the first part. I'm going to help you up.
Okay.
And I'll need you to be back in 3 hours from now. So at 1 o'clock, I want you to come back and we'll do the same pictures again. But this time we'll be taking a picture of the medicine attached to your bone rather than in the soft tissue and in the vein. Okay?
Okay.
So what we need to make sure of is when we do the delayed pictures is that all the pictures match up. The pictures of the flow portion of the soft tissue and of the delay, the bone pictures. So we want matching pictures each time. All right, Rusty, you're free to go.
Thank you.
This is a process 3-phase bone scan. What you're looking at right now is the anterior view of the first phase, which is what we call the venous phase. You can see it flowing through the veins and eventually reaching the soft tissue. During the second phase, or the soft tissue phase, you can see the nuclear medicine accumulating a little bit more. Normally what happens is if there is a great accumulation during the second phase, you can determine whether or not there's an inflammation or an infection process within that area of the body. Now looking at the delayed images, or the third phase, we actually see uptake within the bone. When we see uptake on the first, second, and third phase of the images, then that means that it's positive for osteomyelitis. If it were positive for cellulitis, we would see uptake on only the first and second phase, but not the third phase.